Director of Public Health for Bristol.
And so what have you been doing in the last few weeks then, Christina, just to make sure that Bristol has the best public health possible?
So we escalated ourselves a number of weeks ago, you're probably aware, and just prior to the lockdown we had written to the the Secretary of State to request escalating up the tiers. So we've been working with the Department of Health, Public Health England on an enhanced plan. So we already have our outbreak management plan in place, and the enhanced plan includes taking on some additional contact tracing work, engagement and contact tracing work. Our marshals, who some people will have seen out and about working with the police, ratcheting up our enforcement action, so working with the police and engaging and educating first, but if necessary then using either our powers or the police powers to issue fixed penalty notices or take other action. As always, that's driven by data. So we work very closely with Public Health England and the Joint Biosecurity Centre to see what more we can do, what more we can understand about how the virus is spreading. And over the last 2 weeks we've had neighbourhood tasking groups. So in recent weeks we've seen very clear geographical clustering. So where we've seen that and where we've got neighbourhoods with high rates, we've got neighbourhood tasking groups that's working with the local councillors, local people and local communities to make sure that we understand what's going on in the area from their perspective and get the messages out.
So what differences are people in Bristol going to see once we come out of the second lockdown and go into the new tier?
It's very similar. I think Tier 3 is similar. I think the main difference is that all retail is open, so essential and non-essential retail is open. I believe places of worship are also open, and gyms. So there's a slight unlocking of some of those facilities and services. The main intervention in a Tier 3 intervention, which is different from Tier 2, is the closure of hospitality. So hospitality remains closed unless you're doing takeaway. There are also requirements, travel restrictions. So those of us in Tier 3 areas are asked not to travel out of area except on essential business.
Thanks, Christina.